Some of the challenges, I think, in finding an egg donor, working with an egg donor, are deciding if you want to work with a local agency. Who do you work with? What questions do you ask an agency? What do you look for in working with an egg donor? What's most important to you? Have you thought about this? Do you know anyone else who's done this? Have you ever been able to speak with someone else who's worked with your doctor or the agency that you decide to work with for an egg donor? Most people do come to an agency with a physician. I would get a recommendation. If I knew of anyone who had gone through surrogacy, I would certainly ask them. I would want to know statistics from my physician's office about their surrogate cycles, whether I was working with a donor or not, an egg donor or a sperm donor, or both. There are so many requirements legally and medically for a surrogate that you don't want to be taken advantage of because it's also so expensive. When you start out, you should work with someone that you're comfortable with, an agency, or a third party. You should certainly look at multiple websites to see what the comparables are for pricing, what their involvement is. Ask them questions. Ask the agency. Get in writing as much information as you can. Can you look at a contract? What do I have to pay for this? What will be my refund if something happens? What if I don't get pregnant? What if our egg quality or embryo quality is poor and we have to put the surrogate on hold for a few months? Do we have to pay any extra money? Do we have to pay the attorney separate? Do we have to pay the physician separate? So some agencies will kind of put together a managed program to work with doctors as well as the attorneys as well as the agency and the surrogate compensation. But there are some agencies that will separate out every bill, every charge that you have. You just want to be able to see everything in front of you.